Good morning, everyone. Happy Tuesday. Welcome to our second webinar in our series for High Fidelity Wraparound Certification and Approval. We're so happy you're joining us this morning. My name is Donna Lynch, and I'm with the Resource Center for Family Focused Practice, partnering with the California Department of Social Services. We are so excited you are all here and joining us this morning. While we're letting everybody have a minute to come in and get settled, get their technology working, we have amazing presentations here for you today with the incomparable Manuel Lua and Richard Connect. We're so excited that you all are joining us today. We have so many people who have registered for these webinars, so hopefully they are helping and giving you the information that you need for your organization and county to feel good and successful about your submission for High Fidelity Wraparound across the state of California. Again, my name is Donna Lynch, and I will be your host this morning for our time together from 9 to 11. With that, I am going to put in the chat for you. Please introduce yourselves, your name, your role, your county, and let us know who you are, what you're doing, where you're from. We'd love to know who's in the room, please. Again, my name is Donna Lynch, and I will be walking us through our webinar this morning. Thank you all for joining us. This webinar is being recorded, so all the materials that are dropped this morning will be posted alongside our webinar recording. So if anybody from your county organization was unable to join us, it will be available on our website for you. We will send out a marketing email once the video is up on our website and recorded. We will be also dropping all of the materials here for you in real time. So if you have the ability to drop them and download them, they will be available for you. Our team is unable to send an email to those of you who are unable to pull the resources from the chat this morning, but they will be up on our website with the recording. So don't worry, you will have access to them, and we will send out an email for you. With that, I would love to introduce my team here at the Resource Center for Family Focused Practice. Again, my name is Donna Lynch. I've been here about 4 years now, and my areas of focus are all things peer partner, both youth advocate and parent partner and wraparound. I also have lived experience. And with that, I would love to introduce Tamara. Tamara, come on in.
Hi, good morning. I'm Tamara Trejos with RCFFP. And my background with wraparound is coordinating wraparound programs that have served the Department of Social Services, Kaiser, and school districts, and also post-adoptions. And I will hand it over to our other partner in crime, Lizzie.
Good morning, everybody. So lovely to be here with you all and see so many faces. My name is Lizzie Dembos, and I'm a public education specialist with Tamara and Donna on the Resource Center for Family Focused Practice team. And I will be here just supporting everybody in the room in this space today. Thank you for being here, and I'll pass it over to Donna.
Thank you, Lizzie. Thank you. And we have James. James is our amazing program coordinator. If you have any issues with technology or have any questions, James, come on in and let everybody see your face, please. Side quest, James, he will help you. Good morning, James. Thank you. And with that, I am going to pass it over to Danny. Danny, good morning. Come on in.
Hi, everybody. I'm Danny Gabry. I'm manager of the Family Center Practice Unit here at DSS. Our team is over High Fidelity Wraparound, and we're so excited to be with all of you this morning with our great partners at UC Davis, as well as our speakers. Let's introduce, I have a few of my team here today, so let's introduce them, and then I'll jump into our speakers. So Kayla, do you want to introduce yourself?
Yeah. Hi, everyone. Good morning. My name is Kayla Granderson, and I'm an analyst here at the CDSS. And I have lived experience, also wraparound consultant, and also all things peer partner. And I'll go ahead and pass it to my colleague, Chris.
Good morning, everyone. Chris Petty, also a CDSS Family Center Practice Unit, also a program analyst, been with CDSS for, gosh, over 5 years now. years, for 25 plus years, I ran a program providing foster care services in the greater Sacramento area. And glad to be here this morning, and I'll pass it back to Donna.
Awesome. Thank you. We would love everyone to hold their questions until the end of the presentation. Our team will absolutely be grabbing any questions that you happen to drop in the chat during the presentation, ask them during the Q&A, or we would love to invite you in to use your raise your hand feature at the bottom of your Zoom toolbar. And once we open up the question and answer portion of our time together, you are more than welcome to come on in and ask a question at that time. With that, I will pass it back to Danny. Thank you.
Thanks, Tony. We are so pleased to have two of our speakers here today. One of the great things about the wraparound community is all of the peer support and how much you all work together and share information. So we're pleased to have two speakers. So you're not listening to DSS and UC Davis today. I think they have a great presentation for you. First, we have Richard Connect, managing partner of the Integrated Human Services Group, where he and his affiliates provide program operations, leadership, strategic planning, and training services to public and private healthcare and human service systems. He is chief operating officer, or the former chief operating officer for a large behavioral health hospital, and former senior vice president of program operations for River Oak Center for Children. He's an advisor to state agencies where he provides guidance and cross-system statewide technical assistance to multiple departments. And he was the lead design engineer of the state's integrated core practice model and wrote the template, which now anchors the children's system of care in all 58 counties of California, which is so important. And we're so proud to work on the ICPM also in our unit here at DSS. We also have Manuel Lua, who's a licensed marriage and family therapist with 20 years of experience in the mental health field. Manuel is a first-generation Mexican-American and a proud son of migrant farm workers. Manuel currently serves as Chief Operating Officer at Victor Community Support Services. He served in various capacities of management and leadership throughout his career. His areas of specialization are CCR, ICPM, California Wraparound, 0 to 5, CANS, and CFT. Outside of his work, Manuel enjoys coaching his kids' baseball team. We're going to turn it over. And like Donna said, we're going to take questions at the end. Please feel free to put them in the chat. And all of us on staff will help manage the chat as well. So you don't have to lose your question. Type it in the chat and we'll get back to you later.
All right, Danny, thanks so much for that introduction, and just pleased to be sharing time with my dear friend and thought partner, Manuel Lua, and just happy to be in conversation with you all as we take this really exciting next step in California's trajectory towards effective care for young people in and around the ecosystem. We can go ahead, go to the next slide, James, thanks. So really quick, we're gonna hit a lot of really critical context in the next 15 minutes. And my assumption in preparing this material is that that you all are on some level connected to the high fidelity wraparound planning process, either on the public side or on the community side, right? So understanding the context for implementation, and that word's really important, of high fidelity wraparound is super important. And that's where the connection to system of care comes in. The reality is there's a profound interdependency between the high fidelity wraparound program, the service, the provision of that mechanism, if you will, for kids and families, and the system of care outcomes. Many of you know system of care and wraparound are synonymous everywhere outside of California. When they refer kids to system of care, they're talking about wraparound. When they say we need wraparound for this kid, they mean system of care. Nobody outside of California tries to do wraparound outside of system of care. We have this rich 25-year legacy of wraparound without system of care. So it's unique, but understanding the interdependencies are critical. We're going to explore some of those as we move forward. I'm going to also assume that some of you at least have peripheral awareness to the Assembly Bill 2083 work, which is the system building and laying the context for effective implementation, not only of wraparound, but a host of other things. And all that to say, on some level, the system of care work under AB 2083 has been a contingency, a preparatory process to this moment in California, where we can actually implement high fidelity wraparound for kids across the ecosystem. Absent effective interagency integration in key areas, which we'll explore at least 4 places, wraparound is unlikely to be sustainable or effective. That's the important takeaway. You got to do the system work as public partners and private contractors, or the wraparound mechanism will not work or be sustained. Next slide. So here's the visionary alignment. Definition of a system of care, right? Lovely words. All of you as wraparound experienced folks know this is what how wraparound is typically defined in systems. Notice the common language. Just to drive home this point that nobody tries to do wraparound outside of a system of care. It doesn't work. All of the mutual goals of both system of care and wraparound are fundamentally to keep our kids at home, safe, in school, out of trouble, right? That's the goal of all system of care work. That's the fundamental goal of all wraparound work. Next slide. So here's a definition of system of care that comes out of the national research from the late, great Sheila Pyers and her friends. If you'll notice the language here in quotations, it should resonate with you as a wraparound person. It should resonate with you in terms of your vision statement if you're a wraparound provider, if you're a system of care builder. Language like this is probably present in your system of care MOU, right? And to drive home the point that all of that can be distilled down to organizations and systems sharing risk, resources, responsibility, and reward, right? That's what we're trying to do here. That's what both wraparound and system of care try to do. Next slide. Super important. This slide, the next one, super, super important. Please attend closely to this stuff. The system of care, the interagency relationship between probation, welfare, behavioral health, regional centers, schools, tribes, other partners, however the local county defines its system of care, the job of that interagency leadership team is to create what we often refer to as hospitable conditions, right? So will our programs and services work? Will the billions of dollars that California and the federal government spend on our kids and families be effective in an interagency environment? So paying attention to things between departments like how do we share information? How do we share money and maximize our revenues? How do we train? Do we co-locate? What's the vision? Do we have an organizational relationship that works across the ecosystem? If those factors are not attended to, we can throw money at kids and families all day long and we'll never get sustainable impact towards the right-hand side of this graph. So you see the big heart with wraparound? If we're implementing high fidelity wraparound, absent attending to those interagency conditions, it won't work. And we have evidence for this in California. We've tried to reform the behavioral health system many times in California with money. Doesn't work. We've tried to fix the school system in California with money alone. It doesn't work because we don't attend to the interagency collective conditions, right? So big takeaway for today, don't write a wraparound plan in your county without connecting it to the system of care work, and make sure that the interagency leadership people are fully on board in support of your mechanisms that you're going to bake into your plan, which Manuel's going to start to tell us about in a few minutes. Next slide. Looking at the structure, each of you is either in a public system or is contracted with one of the partners in an interagency leadership team within the system of care AB 2083 work, right? There's often in that structure an executive advisory or an advisory team or a children's interagency collaborative. There's some secondary body that shares the responsibility along with the ILT. We wanted to graphically represent in this slide that when all is said and done, when your wraparound plan is done, it should be part of the system structure. In other words, look for a way to, along with other critical ecosystem reforms, locate the high fidelity wraparound within your system so that there's a routine mechanism. We'll talk about the details of this in just a minute or two, but if you're a visual processor like me, notice the high fidelity wraparound, the community leadership team that you're going to be obligated to create, that belongs with accountability to and within the interagency leadership team, right? So you've got to connect these mechanisms if they're going to be sustainable and supported going forward. Next slide. Sometimes in system of care, other partners ask, why would I care about that reform initiative? And that's true of wraparound too. So you might get people in schools, you might get people in some parts of the ecosystem saying, that's a welfare behavioral health probation thing. And yes, the primary obligation is on those partners, but the reality is youth with developmental needs served by our regional centers are much more likely to get access to needed parallel services within a system of care wraparound environment, right? Youth with chronic absenteeism, suspension issues, or other school issues are much more likely to get their needs met when they're in a system that is connected and deeply integrated, right? We'll get things like fewer youth placed out of home via IEP or special education status, right? Because the wraparound model will be working for kids across the ecosystem. And so kids are not going to gravitate over to schools. You won't see parents running over to their local schools to say, our welfare systems hasn't helped me, child protection services won't help me, or probation won't help me, right? Like I need help. And so we force the schools then to deal with residential placement often. And the numbers on this are really pretty clear, right? We've had an increase in kids placed out of state since on the welfare side, we prohibited that. So across the state, we have more kids placed out of state on special education status in the last 4 or 5 years since we said we're going to stop placing kids out of state. So you see the system connections here. We got to address this from a big picture standpoint. Likewise, we're going to get less homelessness, fewer housing impaired families, right? We're going to get less caregiver strain and stress. That means fewer youth cascading into complexity and deep end care, right? So when high fidelity wraparound works, we get fewer kids in congregate care, fewer kids in residential services, fewer kids out of state. That's the bottom line. And that's why other partners should care about this, because all kids are our kids. Next slide. Thanks, James. Okay, so here are the 4 areas where your system of care MOU really dovetails with your high fidelity wraparound plan, right? So understanding these 4 areas, and there are others, but these are the 4 most important. So there's an interagency leadership team, right, within your system of care work. You're going to also have to create a community leadership team within your wraparound plan. Those 2 bodies need to be routinely connected. They could be even in a small county, they might be close to the same. You might have the same people sitting on those, in addition to others on the community leadership team for wraparound, right? So understand that, that there's a deep designed interconnection between the high fidelity standards for a community leadership team and that ILT at the higher level. Fiscal and funding is an area that you're going to have to address within your plan. Financial resource management is a system of care area within 2083. Same with workforce development and training. You've got to have standards for how you're going to orient and train all of the positions within a high fidelity wraparound model. There's a mechanism within your system of care MOU to address that. And here's another one, the continuous quality oversight and compliance obligations within your high fidelity wraparound plan. Those are supported by, again, the interagency leadership team, the way we share information, the way we share data, right? So you see this more detailed interdependencies. When we say that there are interdependencies between wraparound and system of care, this is what we're talking about. These are the 4 areas that you have to really tune into to connect where your system of care MOU and the interagency agreements therein can support your high fidelity wraparound. Next slide. I've lifted some of the language and abbreviated it slightly from the high fidelity standards to show here by way of 2 examples. So highlighted in red, the community leadership team is going to have to do a lot of things, or going to get to do a lot of things. And 2 of those things that it has to do are deeply supported by and connected to the system of care. To actively identify and remove interagency and system barriers that interfere with interagency collaboration. That's exactly what your ILT is supposed to do. See the connection now, right? At multiple levels, you're pursuing the same objectives here to create the conditions for success, both at the wraparound community team leadership level and that higher ILT level, if you will. Second thing that caught my eye was the community leadership team is going to identify and support cross-agency training and community collaboration to promote family-centered, culturally relevant practices and support the wraparound model, right? So again, this is where the kind of rubber hits the road of system of care wraparound interconnectivity, is within how you define that community leadership team and bring it into awareness specific to the system of care. Next slide. Second area, fiscal and funding, pulled again some language from the state's guidance around what the high fidelity program is going to have to have in it. And notice the language here that across the children's system of care, the partners are leveraged to the maximum extent to meet the needs of youth and families served by your plan. So the service is funded adequately. That means that's code for sustainability and fidelity both, right? Over time and in the moment. Collaboration and equitable contribution across systems partners are principles of high fidelity wraparound. They're also principles of your system of care. Got a link in this deck, which when we get it to you, hopefully will be active, and you can see there's a probably 3, 4 year, 5-year-old funding matrix. It's a little antiquated. We'll need to update it in the next few months probably, but the State Department of Social Services hosts this site where there are some funding mechanisms that can support wraparound, and we'll explore those in a little more detail in just a second, but I wanted to put that link in this slide. James, go ahead and advance this one more slide. So coming up one level, if it's easier to visualize, it's super important to understand that what's being proposed under one plan for your wraparound services is that you have a singularity of one child, one family, right? One team to serve that family, one CANS, which is a whole nother reform aspect that's coming or present before us, or an opportunity present before us, and that one plan across the interagency ecosystem supports that. All of that is true and necessary, but in California uniquely, over on the left-hand side of this frame, this slide, you've got 5 of what could be maybe 8 funding streams that support one plan, one wraparound plan per child. In most states, they fund wraparound with Medicaid money. That's it. That's all states have. Sometimes they'll throw in some state money. If they're really progressive, they'll have some special ed money, maybe some corrections money. In California, we got multiple sources, and this is, again, a partial list. So we have Medi-Cal EPSTT, we have behavioral health services, state monies through what used to be Mental Health Services Act, right? There are state social service allocations, numerous, too numerous to mention in one slide, right? Intensive services, FERS money, all of that becomes part of your fiscal blending that you can put into support the sustainability and integrity of a wraparound plan, in addition to realignment, right? And education and mental health funding. All of this is the job of the interagency leadership team. Manuel's going to talk a little bit more in detail about some of this stuff. Next slide. This is the training component, right? So just really quickly, it's imperative to understand that your training plan includes both general high fidelity, wraparound training, and role-specific training for all roles. And what we want to drive home in consideration of your training plan is that you're not just training wraparound teams. You're training wraparound teams and the public partners who refer kids to wraparound, right? So social workers, probation officers, case managers, whatever the nomenclature is on the ground across the ecosystem, those folks need to be trained to what your high fidelity wraparound model is so that they can effectively get their kids into it and through it, right? It's not just training to the roles of the wraparound plan. It's a bigger approach. Notice also the inclusion of connectivity to our tribal partners and to compliance with ICWA in this regard. So there are samples of training plans from a couple of sectors, which we can share as we get going later on in this process, but just know that when we talk about training, it's big picture, it's large system of care training. It's not just wraparound team training going forward. Next slide. This is the last area. This is the continuous quality improvement. Notice here some of the expectations within the state's guidance for the impact of high fidelity programming. So we're going to get better school functioning. We're going to get better functioning in the community. We're going to get better interpersonal relationship functioning, right? In home, in family, right? Increased caregiver confidence. And there are elaborations on this stuff. So keep these in mind as we look to the next slide. There are, I think, 3 more, right? And then give me, James, 1 second here to go to the next slide. These are the system of care outcomes from the national research. This is a subset of more than 50 well-documented outcomes that happen when people do system of care in Durham County, North Carolina, in Madison County, Wisconsin, right? In some of our counties in California where we've done large S system of care for many years, we get these kind of impacts. These are the outcomes. Back up, James, if you would, to the prior 2 slides. In pursuit, thank you, in pursuit of these impacts that are required now by high fidelity wraparound, this drives home the whole point of my 15 minutes, right? You're going to only get these if you do the system work. Go back, then go forward again, James, to the one more, to that slide, right? This is code for saying The impact desired and sought by the high fidelity wraparound will only come if you do the investment in the system of care work as well. Otherwise, your impact will be muted, limited, or transitory, or not sustainable. Okay, next slide. All right, in addition to all those outcomes, there are some systemic benefits to doing high fidelity wraparound in a system of care environment. So one of those is sustainability. Let's acknowledge the long understood reality that no single agency has sufficient resources to serve kids alone with the kind of complexity of our wraparound kids, right? You've got to have interagency relationships in order to fund the complexity of the model, the expansiveness of the model. Secondly, while 4E and Medi-Cal are highly prescriptive and require matching, other funding is often useful in supporting the necessary components to a high fidelity model. So there are other specialty mental health services codes that you can bill. So beyond the wraparound rate that's coming, the per diem or the case rate or whatever the state eventually settles in on relative to funding Medicaid through a bulk model or a bundled model, you can still use other specialty mental health service coding to meet the expectations or the needs, of the young person and their family, right? Again, there's full service partnership money. You're going to blend this into your plan, right? And figure out how to share these dollars on an interagency basis so that you have one plan. We don't want a wraparound plan for full service partnership under BHSA and a wraparound plan for high fidelity wraparound. They're not two plans, one plan in every county, right? There are school LEA mental health monies. Your CalAIM partners on the managed care side have enhanced care management and community supports resources. Those dollars can't be shared necessarily with public partners, but leveraging those resources into your wraparound plan is something I'd be thinking about if I were writing a wrap plan in a county. Like, what's my relationship with a managed care plan? And how are we going to get kids into those services to minimize the demand on high fidelity wraparound, right? You see the interconnectivity here between reform initiatives. Next slide. As I begin to wind down. So just a moment or two on the practice model. So ICPM matters, and it's critical to understand that when ICPM was published by the state uniquely, it was done so from a wraparound perspective, right? So while there are subtle differences between the research, like the 4 phases of wraparound that you'll see in the fidelity planning work that you're gonna have to do, ICPM offers 5, fundamentally the same, right? And they are essentially wraparound based. Here's the important thing to understand. Training to integrated core practice model is super critical. If we don't train and orient to the large ecosystem of practitioners and professionals across the system to ICPM, then access to wraparound and the vision and alignment necessary will be limited. We won't see the impact if we don't train everybody to ICPM under this kind of initiative. Next slide. All right. I wanted to give you a couple of samples. I think I've got one other county in here. This is language lifted from Tuolumne County's System of Care Memorandum of Understanding. And there's a lot of it in here, but I highlighted in red and bolded 2 elements that call attention to the integration of wraparound into the system of care. Notice in element 12 of their MOU, in this particular section, they say, we're going to work with community agencies to ensure collaborative integrated strategies are utilized and to promote and utilize strength-based, family-focused practice on a system-wide basis. And we're going to do that by coordinating and monitoring delivery of high-fidelity wraparound and enhanced care management services as part of its capacity building and alignment. So this is system of care language that intentionally and specifically connects the system to the wraparound effort. I hope this is resonating, right? Next slide. This comes from Santa Clara, and this is not as detailed, but notice that in Santa Clara, they've articulated within their System of Care Operations Manual, underneath AB 2083, quoting, these youth may receive or need intensive therapeutic services such as wraparound, specialized therapeutic homes, short-term residential therapeutic programs, or TFC, right? So again, using the MOU of System of Care to connect and support the long-term sustainability of your high-fidelity wraparound will be critical. And so Tuolumne and Santa Clara, 2 examples from how they've done that in their memorandum. Next slide. All right, quickly, recommendations, some of which I've hit on already. If I were in county land designing and implementing a high-fidelity wraparound plan, I would be doing these things among others. I would orient and align my interagency leadership team. I would present an overview of the planning process, the requirements, like tell them this is what the state's expecting us under high fidelity wraparound, and get their support for one wrap plan. That's everybody. No outliers. Like we're all on this island together for one wrap plan. I would then identify in that process interagency development team. I would say to the ILT, hey, who are your wraparound experts? Who you want from your department to help us convene and facilitate the programmatic, the fiscal aspects of this to do things like ensuring that we access the new Medicaid wraparound documentation and billing practices, that we make sure we're connected to the full service partnership resources, make sure we understand the standards and expectations. Even though they fall to only a few of the partners within the system, we want a collective impact approach here to make it sustainable and impactful for kids outside of the welfare and probation spectrum. Third thing I would do is engage wraparound and other intensive service providers for input. Obviously, that's stated within your guidance, but that's best done in an interagency mechanism as well. There are limits to that, of course, because some of them are going to be present or future contractors. So you'll have to draw some boundaries around sharing certain details at certain times as a public entity, but just know that you can't do an effective wraparound plan without talking to your providers. And I know we'll talk more on Wednesday with them about this. Fourth thing I would recommend you doing is that I would, as we've just articulated with Tuolumne and Santa Clara's language, I would locate that community leadership team process within my system of care MOU. And that means further adaptations to your system of care MOU. You don't have to turn it into the state in that form, but somewhere hopefully you've got running changes to your 2083 MOU, or talk to your managers or your deputies or your senior staff about that MOU and let them know, I want to put language specific to high fidelity wraparound in that 2083 MOU going forward. Fifth thing I would do, already stated, engage managed care plans and make sure they understand, hey, we're doing high fidelity wraparound now, and we're going to hold ourselves to this certain standards, and we want you to have awareness about that. And by the way, the kids that don't necessarily need that, they belong with you. Enhanced care management means some of these tough kids, they should be in your service domains, and we need to work with you to make sure those kids are getting ECM as needed. Then once you sit down, draft the plan, I would continually agendize, that's my word, the status of the planning process back to your ILT. So on a quarterly basis, semi-annual at the least, I would be going to my ILT or EAC and I would say, this is the status of our high fidelity plan. Does that look good to you? What do you want to know, right? Make sure that your senior staff and the deputies at the EAC level, make sure they know what it is we're doing. And uniquely, if I were in a county again, I would have asked the other non-mandated system of care partners to sign my wraparound plan, right? The state won't hold you to that. They just want signatories from the required high fidelity entities. But I would go to the regional centers, I would go to the county superintendent of schools and I'd say, hey, we want you to sign the wrap plan. You won't always get support for that, but that's what I would make the ask. Finally, here's the portal link to the state. Obviously that you're going to do that. And there's information going into the chat right now. Thank you for all the support in the chat for this. And then ongoing, once your plan is approved, finished, and you're up and running, I would make semi-annual reports to the ILT on the status and outcomes of high fidelity wraparound. So take that information that you're going to learn as you implement high fidelity wraparound, and I would put that into a semi-annual report to your ILT. That's a ton of stuff. Next slide. I think that takes me to the end. Appreciate you bearing with me, and I'm going to hang around to do Q&A with Manuel here. But thank you for that. I think we're going to do all that Q&A at the end, right?
Right. Thank you, Richard. That was amazing and important information. And, I know today's webinar is focused on providers, and to hear how system of care works and what we all should be doing is so very important. And with that, I want to pass it over to Mr. Manuel Lua, I always want to say the CEO, but you're the Chief Operating Officer of Victor Community Services. Come on in, sir, and it is your time to shine.
Hello, everybody. You see my screen okay? Yeah. Okay. Richard's Manuel Lua, Chief Operating Officer for Victor, but I think Richard's presentation is good for this group because every time I hear Richard talk, it reminds me that as a provider, I'm just a cog in the wheel. And sometimes as providers, you tend to think you are the wheel. Well, you're a part of the wheel that serves kids and families. And we're only going to be as effective as our relationship with our partners. And I think that's what this certification thing is about. So a little bit about me. I got into wraparound over 20 years ago when I needed a part-time job, and I took on a job as a family specialist and thought it was just going to be a part-time job. And 20 years later, 6 different wraparound positions. I'm still doing wraparound as the chief operating officer at Victor in different counties. Let me tell you a little bit about today. So let me talk about Victor first. So we're in 14 different counties. We provide an array of services from 0 to adults, including wraparound. We've been doing wraparound for over 25 years. We have like 9 distinct wraparound programs in 6 different counties. We serve 1,100 kids wraparound. So we have a lot of experience doing this wraparound, and we've evolved wraparound as wraparound has evolved throughout the state. Let me tell you how today came about. Donna, typical rap hype lady that she is, calls me to this meeting and says, "Hey, will you do this certification training?" Trying to hype me up and trying to pump me up to do some training. And it works half the time for Donna. But I had to slow her down and say, I asked a question of the group. There was a bunch of UC Davis people all pumped up about this. And I said, how do you know everybody's hyped up like you guys about the certification thing? How do you know this is exciting for all of us? And we had a conversation about that. And so I thought it's important to acknowledge that. I know for myself as a provider in different counties, I felt some tensions. Like I felt some internal tensions anytime the state wants to align or standardize things in a state where every county wants to do it their own way. Providers sometimes get stuck in the middle. And so I want to acknowledge and name the tensions that I experienced, and maybe you are experiencing too. And do me a favor, put them in the chat if you have other tensions besides the ones I name here. I'll go into each of these, and then I'll tell you about the opportunity once I have perspective that each of these tensions provide. So the first tension for me was, will this create hierarchy? Meaning somebody telling me what to do. And I'll tell you about the opportunity I bumped into after I explored that for myself. Will this be prescribed for families, which we never want to do, right? That's a tension I felt. And then lastly, is this going to be bureaucratic? Meaning there's going to be rules, regulations that I have to follow. And if I don't, I'm going to get my hand slapped. So this is what I was feeling. I don't know. Do you guys, fellow providers, put them in the chat? Donna can read them later, but I just want to acknowledge that with you all. So once I got through some of these tensions and I just pulled back and had broader perspective, I was reminded of the tensions our families serve or have, right? We're asking our families to change. We're asking them to do something different, or they're asking of themselves. And it's hard. And I think most of these tensions that I was having was just because of change. And typically tensions that I have as a provider lead to an opportunity if I can have good perspective. And I was reminded of this really good quote by Albert Einstein, which I think you guys should hold on to as you're going through the certification process. A little history lesson. I was not around in 97, a little bit later, but 97 is when we in California coined the SB 163. This is kind of when wraparound got formalized for California. There was hints of system of care and wraparound-like services, but it wasn't really formalized till 97. And then in 99, we created these things called the standards. So these standards that you're going to walk through in the certification have been around for a while. And then after that, believe it or not, there was a semi-certification process occurring already in California. So there was a handful of us that would go to different counties when they were starting a new program, and we had to do RAP 101. We had to certify them. They went through a checklist. Some of you are nodding your heads because some of you guys remember this. So this isn't new. This existed, and this was intended to start your wraparound program aligned with what we believed were best practices or standards. And this is how we rolled in California. This is how we did business for a while. When Prop 63 came, MHSA, it really expanded wraparound. It's really blew up, I think. You started seeing counties apply to do more wrap, and there was a lot more trainings happening. Milton's nodding his head. He probably was around back then. And so wraparound grew, but it grew on these standards. You were required to do wraparound based on these standards. The state had oversight back then. And so wraparound grew and was getting outcomes and it was consistent. Realignment occurred in 2011 and it had all good intentions, right? It was to provide more control to the counties so they can decide what to do with their funding, but it also pulled the oversight out. So there was nobody overseeing were programs doing wraparound consistently throughout the state. And this is just my humble opinion. I think this is where wraparound diluted and changed. Some counties let go of wraparound. And so it just changed. And I think it's full circle time. So as somebody who doesn't like bureaucratic processes or things, I'm in favor of this because it's time to get more consistent in what we call wraparound in California for the sake of children and families. So a little history lesson. So again, you're going to experience these tensions as you go through the certification process. My hope in this process is that it's not top down, that it's not overreach. My hope is that in good partnerships like Richard talked about, we create an equal investment in what is good wraparound between county, state, and providers. Because I think if we're going to do the certification well, providers have to have a game plan that the county's aligned with, and it now requires them to be aligned with the provider and the state. So if we have those three systems aligned, it's good partnership. The second tension you might experience is, does this feel prescribed? Some of you are going to probably call it this or feel like it's this. I don't believe so, because we were doing this before. We were able to do good principle-based wraparound under a framework of the standards. And I hope that's where we land. And I think that is where we're going to land. The standards, I've gone through them. I played with them. I'm going to show you how Victor intends to do it. I'll go through a couple standards. It's just the framework. And within that framework, it's really principle driven. You have to talk about how you're going to do that particular standard. Lastly, the bureaucratic piece, this would be my biggest tension. And for me, bureaucracy is when it's regulatory, it's rules. Being part of the certification development process, we were very adamant that this should feel to the provider as support. And if we're not aligned, there will be technical assistance provided. This is what we used to do. In the old days, when we'd go to every new program and they weren't aligned with one of the standards, it wasn't like you just got slapped in the hand. You got trained, you got supported. The goal was to get you up to speed to that standard. So here's how I've come to peace with these tensions is if when I pull back, I look at the big picture. And the big picture is that we're trying to all get aligned so that we can do this thing called wraparound more consistent for the sake of children and families. And we will do it under the support of UC Davis and other entities that are going to provide training so we can get aligned. So anyway, other tensions you may have, it's important to acknowledge them. First talk about, we're a group of therapists and social workers, so it's good that we talk about those tensions that we're experiencing. And then try to pull back as a leader or manager, if some of you are that, and have perspective in the greater good of this direction. Okay, so a little bit about Victor. Here's our opportunity. It's daunting, I think. This isn't easy. Donna can hype me up all she wants. This is not going to be easy. We're in different counties, and we've evolved to different types of wraparound, believe it or not. And we've evolved to that not by choice, because the funding is different, because the regulations are different, because the county wants a slight different document, et cetera, different EHRs. So it's evolved to this slightly different variation of wraparound. So our opportunity is that we can hopefully have one model of wraparound that we can align counties with. So here's, I believe, the advantage we're at Victor. So pre-certification, remember, I'm a dinosaur in wraparound, so I believed in Fidelity before certification. So as the CEO of this company, I always believed that victors should strive for fidelity in Victor's model of wraparound. So we've developed an internal process to create fidelity amongst all our programs based on the wraparound standards. Now, there's variations because counties have different funding, but we were always striving for this fidelity of Victor's wraparound model, which it will now be the wraparound standards that we strive for. The reason I believe fidelity is important is because when you do wraparound more consistently, it allows you to train staff and develop staff more consistently. When you develop and train staff more consistently, ideally, they deliver a consistent service that will deliver better outcomes for families. So this is why I've always believed in fidelity, regardless of the certification or not. Ultimately, it holds ourselves accountable as a provider to children and families. So here's my advice. If you're a provider and you're in multiple counties, first things first, start internally. If you have different directors or supervisors in different programs, there's a likelihood they've evolved their wraparound program slightly different. Different practices, different assigned tasks to different people. First and foremost, start in-house. Develop an internal understanding through the standards of what we're going to do. And I'll show you how we've started to do that, and we've tackled some dissonance in different sites. And then, like Richard said, we then need to partner with our external partners for alignment. So, but first and foremost, start internally. I think when I say internally, it's top. It's directors, it's executive directors, it's regional directors, whatever your agency calls a senior position assigned to programs, they need to be part of this process. Sometimes we delegate this out to supervisors or managers, middle-level managers, and the directors stay out of it. I think that's a mistake because that's putting a lot of ownership on them without the top leadership being part of the process. So I would start with high-level leadership aligning themselves with the standards so that the high levels trickle it down to the rest of the staff. So that's my advice. That's how we've been doing it. Executive leaders, high-level leaders meet once a month and they review inconsistencies and practices. What we'll start doing now is we'll review inconsistencies in the standards that I'll walk you through in a bit. This little visual kind of can show you the flow or the process that we envision doing. And again, this is me thinking from the out. We haven't started this yet. None of us have. But I'm thinking the additional layer we're going to do here of what we're already doing is using the standards as the staple that we build off of. But as there's inconsistencies, creating internal alignment, then bringing them to our county stakeholders for discussion. Sometimes the misalignment might be internal. Sometimes the misalignment might be our partners. This is our opportunity to align everybody and then adjust and refine as you go throughout the process. I think we'll bump into things as we go through this. I know we already did. You're going to bump into like that cold mirror in the morning that tells you, hey, you got to get better at this area. And I hope that's what happens because it just means that we have to get better. And then we invest our energy based on a metric, not just anecdotal information we have. So whenever you're going through the standards, here's the framework that we're gonna adopt and that I'd like to teach you all. That each of the standards is implemented by a person or people, right? So you have to isolate who is doing it first and foremost. Then you have to talk about what are they doing. So people and process. Each standard really is people and process. There's a position doing it. What are they doing? So I'm going to give you a couple examples. So we isolated 1.6a. So this standard says a natural community support inventory is developed and updated for every family. Okay, so I just took 3 of our programs and just took them for a test drive, just to see what would happen. And the first thing I bumped into is program A. We had nobody assigned formally to do this process. Doesn't mean it wasn't happening, but it was inconsistent. There was just nobody formally assigned via documented process or some manual or something in writing. It's just nobody assigned. So guess what? You don't assign somebody to it, it's not going to happen consistently. And so what we found is that because nobody's assigned, this activity is not happening consistently. So there's a gap, right? So the gap is obvious here. We got to assign somebody, and we have to train them. We have to document the process. We have to train their supervisor on how to oversee it. So you can see the processes we have to go through as a provider to make sure we attend to that for program A. Program B, they're killing it. They have somebody assigned. They have a documented process. It's sustained. You can see it's happening in program B. They're fine. I'm going to leave them alone. They're going to get kudos. They're going to get props. They're going to get a good job. Program C, same thing. Something is happening. But here's one thing to know. Remember earlier I talked about how the standards can give you autonomy within a framework? Well, you can see B and C have different people doing the task. That's what we call in wraparound as long as the need is met, right? The need is met. I'm not going to dictate or become bureaucratic and say it has to be this person. The need is met. It's different individuals, different roles, and both programs have it documented and are aligned. Does that make sense? Okay, I'll do a couple more just to see if this works for y'all. So there's this thing in the standards called the family vision. And it's recommended it's completed with every family and documented in the chart. And it's probably an electronic health chart now. So again, program A, no one is assigned. There's a gap. We have to assign this. So the process is inconsistent. It's not happening. So we'll go through the same process. And B and C, notice again, different people are doing it, but it's getting done. There's a process documented, so sustainable. It's not just one supervisor's opinion. There's a documented process in place so it'll sustain. So again, here's an example where my energy will go to program A internally and then get them trained up, get them supported, get them what they need so that they can get aligned. Again, this is still internal. I have not even reached out to the counties yet. This is just me getting my house straight before I reach out to the counties. Okay, the last example is, Richard talked about the importance of training, and there's some standards that refer to training as one of the standards. And so this is one of those. So facilitators receive ongoing training and coaching to engage the team in a plan and process that elicits multiple perspectives. So A has this in place. They have all facilitators are trained. They actually have a position called a coach, because this is something this county has promoted. And so there's a coach in this particular program that's their full-time job. And they have this documented. When you get hired, you get this training, and annually they get a refresher. So I feel good to check off the box here for this one. But here's what happens sometimes. You're going to run into like program C, where there's inconsistent training. In this particular program, the training is very supervisor based. There's various supervisors, and one supervisor does it, another supervisor doesn't do it. So it's inconsistent. The training happens, but it's not formalized. So we have to formalize the training process here. So my energy here as a leader, a manager, administrator is, oh, we have to formalize the training. And by the way, we don't have to recreate the wheel. We can learn what's going on in program A and B and implement those kinds of processes in place. Okay. I will pause. This is our strategy towards this. Notice I'm starting you with internal first if you're in multiple counties. Because if you're in multiple counties, there's a high likelihood you've evolved to slightly different practices. So you start internally through a people and process assessment, and you try to get aligned. The next step is now approach our county stakeholders and see if the dissonance is on their end. For example, in one of these, it's because the county does not require a family vision statement. And because the county does not require a family vision statement, the program has not started doing it. So the dissonance is on their end. We have to get them aligned in their scope of practice. So we have to lead them in that direction and have those conversations. So here's where I've landed with the certification. I started you with, like, Donna was trying to hype me up. I'm kind of hyped up a little bit, not as hyped as Donna. I'm ready to do this for the agency. I'm ready to do this for kids and families. I think this is a great thing for the evolution of wraparound. If we don't do this, we run the risk of wraparound being extremely diluted. And then it's not wraparound anymore. So that's my presentations. Questions, feedback, thoughts?
Manuel, thank you so much. I love that you opened with the tensions and opportunities and highlighting how those, approaching certification and approval are feeling and we're feeling. I'm always going to be your hype girl, 100%, everyone in this room. And there's over 300 of us. We're excited. And breaking it down to people and process, thank you, identifying the gaps. I was worried about program A, and I was so happy to see that they had one. I was like, oh, good job, program A. But I do want to open it up. There's a lot of us here. We have both Manuel, Richard, we have our CDSS team, and also, of course, our RCFFP team, to open it up to questions, take this time and opportunity to lean in, use the raise your hand feature. Timothy, thank you. Come on in. Yes, sir.
Manuel, well done. Thank you very much. My question is very simplistic. I apologize. You appeared to be going through programs by utilizing the California Wraparound Standards, the document that was just posted in the chat right when you started.
Correct.
But it didn't match up exactly to what the document has. So I'm just sort of curious, is it just sort of a figurative, hey, you had a previous version and this is the standards that we should use, or is there another checklist that you're using that we should be using?
We pulled it directly from the link. So I structured it different through people and process for the purpose of this presentation. But what I took is 1.6A and just put it on the top. But I structured it different for the sake of the presentation.
So you had 4.3A.
Okay.
And I realize I am splitting hairs here. There is no 4.3A. And when you read it, it didn't read like the text you were showing.
So we might have pulled it incorrect. So I might have caught it. For the purpose of this presentation, I wanted to give you an example how to just take a standard.
But this is the standards to use.
Yes.
Okay, great. Absolutely. I just wanted to make sure I didn't have the wrong.
Yeah.
wrong
My
spot.
advice for providers is use the standards, the accurate standards if I use inaccurate standards.
And
And
then I
then just
think
break them down by people and process. Who's doing it? What are they doing?
just because I have you in a public forum, your favorite county to work with is?
Oh, San Bernardino.
Oh, thank you so much. I so appreciate that. Hey, I really appreciate it. We'll talk more, Manuel.
Yeah.
Thanks.
And by the way, I have several of my programs here. You know what? If we approach this, like Donna said, she was worried about program A. I'm not. And I don't think we should approach it that way. It's an opportunity for program A to learn, to get trained. And they probably evolved that way, not because they want to. Sometimes they don't know better. They haven't been asked to. The county maybe not be asking of them of it. And it's an opportunity for growth. So again, my hope is that we don't take you didn't meet the standard, here's a slap. No, you didn't meet the standard, here's the opportunity, let's get aligned.
Lori, please come on in.
Hello. Hi. This probably is a question, Richard, for you. We're talking about AAP, post-adoption, and certification. And I was just curious about two things. How do you see this fitting into the system of care? And do you see providers from the post-adoption world being on the community leadership teams at the county level?
Hey, Lori, thanks for the question. I'm going to actually invite if it's okay, someone from the state that maybe has better awareness around the history of inclusion of AAP thinking and policy into this, because I think it's a fair question and one that I know will resonate with others in the meeting today. So I don't know if Danny or somebody from the team on the state can help us with that, but it's a good question.
Yeah, sorry, can you repeat the question? I was reading questions in the chat.
You want me to repeat it?
Yeah.
Okay, so I was just curious how we're seeing AAP adoption assistance based and adoptions fitting into this, and if the post-adoption people need to be on the community leadership team or the executive teams, like our leaders, and just if you can kind of wrap in a little bit some post-adoption language and what we need to be paying attention to is in this development process. Thank you.
So yeah, so we have worked hard to try to align the portal for certification with all programs. So there might be a few cases when you go through where you see not applicable for AAP wraparound. Like there are certain places where the standard doesn't quite fit, and we have provided the option to just put not applicable. So that is one way that you can go through the portal and find that there are places where you do not have to complete that section. So other than that, we really do intend and hope that AAP programs can apply for certification and achieve full certification. So that is our hope and our goal, is that we have this available to all of you as well.
Okay, so there was I'm sorry, I had a kind of a two-step. Sorry if I layered it up there a bit. My question is when we're looking at the community leadership teams and we're looking at how we're creating these larger systems of care, if the thought is that people who are providing post-adoption services are needed to be in those leadership teams, or is there a place for post-adoption in relationship to what's going on with county development of not necessarily certification, but just the teams, so that we're in the interagency process?
I think there's always a place for all of the stakeholders and all of the participants in a community. We have not discussed that being a requirement. I'd be interested to see what our UT Davis friends also say, but I would say there's always a place at the table for anyone who's invested in wraparound in their communities.
Agreed.
Yeah, I would just offer, Lori, I think particularly if I were in a county where the long-term adoptions outcomes are not great, if I were in a county, for instance, where we had a significant number of kids that had been through the adoptions process or guardianship and they bumped back into the system, that's a county where you're going to want to be as emphatic as you can be that you need a place at the table for the adoptions experts to help structure the wraparound plan, write the wraparound plan, right? Because obviously something's not working if kids that we adopt out, if we can't sustain them in adoption. So I would start with the data and really hammer on what's the data say about our current adoptions work and the landscape there.
Would you consider, Richard, just for my own edification, would you consider kids' requests for post-adoption wraparound as entering the system again, or would it be kids who've actually there's been a founded report on and they're getting services? What would be the difference there?
Yeah, we're starting to get into some policy stuff that is going to be different county to county. So I'd probably just
okay.
I don't think it's that question because we'll create some dissonance for some folks. But it's again looking at the data around how successful are our adoption services in our county. If they're working, it's less critical maybe that there be an adoptions focus in the high fidelity plan. But to Danny's last comment, I think there's always a place and there should be a role for the wisdom from your local folks to support your plan, right?
Thank you. Thank you so much.
Awesome. Thank you, Lori. Manuel, we have had some questions in the chat. The first one was, this is a long process to create infrastructure. How long did it take your organization to stand up your program and get high fidelity wraparound certified contracts?
Well, nobody's certified yet, right? The process hasn't started. This is just the game plan that I'm suggesting if you're a manager, lead, or administrator, need to start putting in place at your office. We have some time to work on this. The state's not pulling the trigger on this anytime soon. So you've got some time to work on this. I think it's going to take a bit, but it's worthwhile time. It's if you're a leader or manager of a wraparound agency or program, this is what we should be putting our energy into. So I'm not sure how long it's going to take. I only gave you 3 examples. There's 4 other programs I didn't put on here that we would have to also assess.
Right.
But bumping into something that needs alignment, it's an opportunity. So I'm not sure how long it's going to take. We're going to get started as soon as possible. So internally, that's within your control. Then you have to reach out to the county stakeholders and get them aligned too.
Excellent. Thank you. There was another question in the chat. We will have a system to know that policies will be accepted prior to having them approved at the county level. So what are we not wasting our county council's time with policy that will not be approved? I don't know who asked this question or if it was asked I'm going to put this in chat and I see an answer.
Jump in and take that
Thank you.
question. Yeah, sure. So we don't have a process for you to come in and check those policies ahead of time. We'll review your submission after you submit. However, if you're like, oh, we're going to put these policies in place, we would love some feedback from UC Davis or CDSS on, is this a good idea? What does this look like? Just reach out to us for technical assistance. We're happy to meet with you. We're happy to have those conversations before you go ahead and within your county systems. We totally get that this is a long process and there's a lot that goes into it. So if you have questions like that, just reach out to our team for technical assistance. Our team will drop that link in the chat. You can also find request help, request TA all over our websites, both in the portal and on our wraparound toolkit.
Also, not everything has to be a policy. It just has to be documented, whether it's in a procedure or a manual or something of that sort. So I for one, am going to try to stay away from creating policies, rather procedures or a training manual that gets referenced for all employees, because policies have their own processes, right? And so be careful with policies, because in truth, policies are supposed to just be high level risk issues. I think we're talking about practice processes here.
I did drop in the chat. We have our next technical assistance office hour drop-in session this Friday, the 8th from 2 to 3:30. The registration link is here in the chat for you. The next question was, I also worry with FFPSA aftercare, high fidelity wraparound, BHSA high fidelity wraparound, and Medi-Cal high fidelity wraparound. I worry that they will not be in alignment, and then you will have 3 different county state groups overseeing it all to have to be in alignment.
Yeah, it's a real
Go ahead,
tension.
Noel.
It's a real tension, right, Richard?
Yeah, it is, but it's also an extraordinary opportunity to finally get to one plan, right? So I think we should first off acknowledge the incredible investment that CDSS and DHCS in particular have made into aligning both the standards, the fundings, the primary funding streams, and it's been years in the making. And that question, your question, Laura, which is a really great one, has driven their desire to get to alignment between the 2 departments. And it coincides with alignment on IP cans, right? So you see the pieces of this puzzle towards one child, one plan is finally a reality in California, which is phenomenal in many respects. If you're gray bearded like me, we've been hitting around the edges of one child, one plan for decades. But we now have multiple ways of funding wraparound. We have a system of care in place, and we have a fidelity plan coming for IP cans. If we can get to 1 cans per kid, we're going to get to 1 plan per kid, which is absolutely amazing. So the opportunity here is amazing. The question, though, Laura, I think speaks to one of the imperatives I was trying to present in my initial 15 minutes, which was you've got to take that dilemma to the interagency leadership team and make them aware and make those department heads aware that don't be supporting a fragmented BHSA plan. Don't be supporting a fragmented high fidelity wrap plan that doesn't have awareness from other partners, right? Like bring force leaders into awareness around one plan for the system in order for us to get to one plan per family, per kid, right? Hard to do, but you just keep raising it, and persistence will win the day here. You just keep asking for an audience back at that ILT table. And if it's not ILT, once your community leadership team is up and running, there are going to be ways to socialize that work, right? Maybe with your board of supervisors, right? Maybe with other audiences. Just raise the level of awareness wherever you can for the reality that you need a singular aligned plan for all kids in your county.
Thank you, Richard. I do want to address one of the questions in the chat will the county partners come online and also get certified to ensure they are online as well? Yes, our county partners are submitting an approval plan and demonstrating that their policies and procedures and also documentation support high fidelity wraparound. Here's another question. We've been in discussions with several counties about contracting for STRTPs. They are giving different responses to starting the wraparound process. Some say they are ready, while others say they are not contracting for it with STRTPs due to existing wraparound providers. Should we continue with certification process with this uncertainty among counties?
Is the question, should we continue with high fidelity wraparound certification?
Yes. So yes, you should continue your certification process and going through the standards and your submission for high fidelity wraparound within the portal for your organization.
Yeah, to my thinking, the uncertainty or ambiguity around STRTP capacity is just more imperative to get the wraparound plan in place. But maybe I'm missing, I don't want to oversimplify, but that's my sense.
I think going through the process for an STRTP, you'll bump into a lot of gaps that'll be important for you to really process and discuss. Should we even be thinking about doing this? Do I have the resources? Can I do this well? What I hope doesn't happen is everybody wants to go get certified even though they can't do it well. Like, know what you do well and do that well. We need help in other areas, not just wraparound. So the process should teach you, should I be doing this or not?
I love that. We have been putting a lot of resources in the chat for you. Tomorrow's webinar is for prepping for high fidelity wraparound county plan approval from 1 to 3. We will have Gavin and Dre from Placer County speaking to their prepping their county from 1 to 3 tomorrow. Also, our technical assistants, all of the PowerPoints and resources have been dropped in the chat today. Let's see. Thank you, Milton, for your comment. I would like to continue to keep this open dialogue for any questions. Does anybody else have any burning desires and questions? You've got an amazing panel in front of you now, and I'm telling you to take the opportunity now. Will you get the invite for tomorrow? Yes, the link is in the chat. It is a registration. You will have to register to get the Zoom link for tomorrow. I did not think we would end early this morning. This is unusual for our wraparound community to not have a fast, rapid fire questions coming in the chat today. I do see one here from Robert. With the WRAP requirement for immediate needs and STRTP, we can't survive without WRAP certification. Yes. Right after. Okay, here's another question. Our agency provides focus to high fidelity wraparound to 0 to 5 population. We do not provide aftercare to STRTP of the child family team. Should the agency still work towards certification? This might be a great question for you, Danny. Oh, you're on mute.
Sorry, once again, I was reading and replying to questions and not listening to questions. I'm sorry. Can you repeat the question?
Yes. Our agency provides focus to high fidelity wraparound to the 0 to 5 population. We do not provide aftercare to STRTP. Should our agencies still work towards certification?
I think that's a choice right now. It is mandated and required for 1 year from now for aftercare providers to achieve certification. However, we have opened the portal for anyone to apply for certification who would like to demonstrate that you meet high fidelity standards. We also do anticipate utilizing high fidelity wraparound for the immediate needs program in a few years when that launches. So that's a little bit of a longer runway, but obviously it makes sense to start getting ready now and being prepared when immediate needs starts to launch. We have many decisions to go and letters to come out on what that's going to be. So I don't want to get too caught up and worried about that, but we have, stated in the letter that that is kind of the intent right now of the state, is to utilize high fidelity wraparound in the tiered rate structure. So that would absolutely be a good strategic direction, is to start getting your certification or to start getting your ducks in a row, start getting paying attention to all these webinars, joining the TA office hours. You don't necessarily have the same 1 year time crunch as aftercare, but you have all of the resources, tools, and the open timeline to do so. And we encourage everybody who would like to be a high fidelity wraparound provider to do so.
I think the question is, do I want to get aligned with what is best practice and standards of wraparound? The certification is a byproduct. I mean, I know we're going to be required and things of that sort, but first and foremost, the people who developed these standards were wraparound people. And it took a while. And there were providers, and there were county, and there were people with lived experience. There were state folks. So this is informed by what folks who know wraparound believe wraparound should look like. So I guess maybe reframe the question, should I get aligned with what is best practice standards?
Yes, thank you. And I did say child and family team. I apologize. That is seared into my brain. CTF, Community Treatment Facility. Kimberly, please come on in.
Thank you. My question is around our county. I'm in Santa Barbara County, and we have 2 wraparound programs in our county. So I love the message, one program. We at Casa Pacifica run the wraparound program with DSS and probation, and we do aftercare wraparound and AAP. And then back when Prop 63 MHSA first passed, our county mental health does the other wraparound program funded solely through MHSA dollars for any Medi-Cal child who does not fall, who's not a 300 or 602 or AAP youth or aftercare. Well, they'd be a 300 then. So they get all the MHSA and now the BHSA dollars. So we're not technically FSP given we don't get that funding. So we have WIT leadership where we meet with mental health and DSS every quarter and talk about how things are going next week. And I'm assuming they're going to be in the county meetings coming up. And I believe the person from DSS who oversees our wraparound has been a part of this planning process. But my thoughts are there's going to be a plan where our 2 programs need to merge at some point. Either the county takes over the SB 163 wraparound or they merge their Medi-Cal, their BHSA wraparound with us to be high fidelity wraparound using all these funding streams. I love all the funding streams that you guys showed. So I guess my question is, so I'm going to be talking about this at WIT Leadership and making that, we're going to be getting certified in our own program. Is there a plan to, what are we doing with BHSA dollars and the other wraparound program? Asking them, are you guys in these webinars? I'm assuming I didn't see anyone in the first one. So anyway, I don't know. I guess any suggestions for me on what we should be doing in Santa Barbara County as a provider? We are the provider, the sole provider for the 163 wraparound.
I guess if I was you, This is a question I would sit down with my partners, the county, and have. I don't think anybody in this room can answer that for me if I was you. I'd probably sit down and say, how do you want me to approach this? Remember, this is intended to be partnership oriented. So, I mean, it sounds like there's some, remember, wraparound is involved to a lot of different things in every county. So that it's not as simple as sometimes things get rolled out. There's a lot of untangling of things and things we have to clean up. And I don't think we providers can do that without talking to our county stakeholders. So as much as I said, start in-house, we're going to talk to our county folks and say, this is what we're doing. Are you okay with this plan? Before we really start doing the in-house work. So that's what I would do, Kimberly. It sounds like it's complex there. And you probably need to just have a plan before you approach it.
Okay. And we do have great, I mean, our county is wonderful. We have wonderful relationships with both mental health and social service and probation. So I feel very fortunate for that. And then I guess just to clarify, if they do want to keep the two separate wraparounds and have BHSA be really focused on the Medi-Cal only, not probation and child welfare youth, we can still get certified as high fidelity wraparound without BHSA dollars, without being an FSP.
Certification really will require using multiple funding sources. I think one of the important things to remember is that if we have a Medi-Cal only funded wrap, it doesn't include some of the more flexible funding sources that's really critical to high fidelity wraparound. But also I would remind you that your county is also responsible for completing the portal and doing their county plan. So this is not just on you alone as the provider. The county also will be submitting and have to talk about all of the same standards themselves. So your county child welfare department will have to be able to demonstrate all of this if they're the ones submitting the plan for aftercare. So but you are not sitting on an island by yourself doing this. Like the hope is that everybody would be working together. I also just want to remind everybody that when it comes to the BHSA and the Medi-Cal plans, that we are in a state of change on that side as well. And there's still decisions to come, and there is currently a concept paper out for public comment. So all of you are encouraged to review and provide comment if you feel necessary or you have feedback to DHCS. I believe they listed the date as the 21st as the deadline to provide comment, although I could be wrong. I can find it and put it in a chat for everybody, because I know that there are a lot of moving parts and various pieces that are all changing at once, and we recognize that that makes it difficult.
And then just, Danny, thank you. Just that child welfare submits a plan in partnership with mental health.
Yes.
Okay.
You will need to, the county will have to submit a plan, and they'll have to be in collaboration with child welfare, behavioral health, and probation. So
Perfect.
they will all need to be working together to submit a plan on their end as well. And it's the same portal. They have to do the same portal. They just might fill out some of the answers in a slightly different way, because instead of how do we deliver the service to the standards, the perspective would be, how do we hold our contractors responsible for delivering the service to these standards? And therefore also, how do our contracts allow for these to all be met? Right.
Thank you.
Danny,
Okay. Thank you so much.
Danny, I think maybe for clarity, we should just make sure that we have some understanding for this group around what the word program might mean. We don't want to conflate program with contractor, right? Like nothing in what we're talking about suggests that the county can't have multiple contractors, multiple contracts delivering high fidelity wraparound. So if by program you mean the county's going to have one contractor, that's not what's being suggested.
Yeah, we cannot dictate county contracting processes or who they work with. We do recognize the importance of counties working with STRTPs for aftercare for their youth when that is the most appropriate decision, but counties have discretion.
Thank you. Gala, please come on in.
Hi, thank you. So my question is related to the interagency leadership networking that Manuel, you were talking about. I think I'm coming from Humboldt County, so obviously a really rural county. Our leadership has very informal networks with other partners, so whether that be the county or the regional center and things like that. I was wondering if there will be any leadership networking opportunities facilitated through UC Davis and through avenues like this, because I think this is really valuable information. And I also believe that generally high-level leadership directors and things like that, a lot of value could come out of them talking to each other in those direct things. So are those opportunities available or in the works?
Yes, we're hoping that our technical assistance drop-in hours are going to turn into exactly what you're speaking to, those networking opportunities where counties and providers can come together and talk about all things certification and approval, gaps, barriers, people, processes. We want that space to be as valuable as we can make it for all involved. So I would encourage to invite your partners to that space where we could have those open conversations together. Absolutely. And I know right now we have TA drop-in hours through September. Our team, along with CDSS, we're more than happy to continue those times and availability. As if you build it, they will come. So we will keep that an ongoing opportunity as needed. So yes. Absolutely.
Awesome. Thank you.
It's Richard for folks. I just did drop into chat. The coaching, implementation support, technical assistance for all things ecosystem it happens in lots of places in California, just not by design necessarily, but it's just the nature of the complexity of our system. So one of our partners, the Child Family Policy Institute, is one of those places where organizations can get support for figuring out the interagency complexity, whether it's at the system level or in some cases more at the practice level. And that flyer I think I put in there is for their next upcoming series in September, where if this interests you or if you feel like your senior staff in your county need extra help or coaching to get their interagency system of care work further developed, that's a place where you can go for some help, is to CFPIC.
Awesome. Thank you, Richard. I also did drop in the chat the high fidelity wraparound concept paper that was released by DHCS. There's also instructions on how to provide feedback for that concept paper. We are highly recommending that you provide feedback to DHCS, and I believe the date, I'm not supposed to say dates. August 21st is the deadline. And I did, for those of you who are here in regards to Adoptions Assistance Funded Wraparound, the AAP unit is having working group sessions. I did put the session dates and the registration links in the chat for you. So please join those sessions, and AAP that will be there to take your feedback as well. Those resources are also in the documents that we've been dropping today. I'm looking through the questions. I'm trying to see if we've answered them all. Maybe this one here. And I believe we answered it. Should full service partnership programs be working towards certification as well? The answer is yes.
Yeah, and just to drive that home, our esteemed friend, Dr. Haugen, pointed out that within your BHSA integrated plan, so if you're unfamiliar with this, county mental health plans now have a system of care integrated plan. State doesn't call it system of care, but it's essentially system of care. They have to figure out how they fund the entire spectrum of mental health care within their purview in one plan. And within that process, you're only going to be able to pay for high fidelity wrapper. So I think the answer, as Tim's pointed out, is a clear yes.
And I do want to be clear that the legal mandate on certification is for aftercare programs need to be certified within 1 year of the date of the letter. So by mid-July next year, like July 15th was when it was actually published. That's not what it says on the letter, but it went out on the 15th. So I just want to be clear that we have created a process that is open for everybody. We want everybody in the wraparound community to be able to achieve certification, regardless of if you're on that 1 year timeline. So the portal will be open. It's not just, a 1 year process for the portal. This is ongoing. So if your programs are working towards any of these other milestones down the road, You are always welcome. You do not need to adhere to the 1-year timeline, but you are welcome to join all of these resources, the webinars, the TA office hours, and work towards certification at whatever point in time that makes sense for your agency. So, and if it were me, right, and they were saying that AAP needs to adhere to the standards, the best way to demonstrate that you align to the standards is certification. That's the easiest, cleanest way to demonstrate that you meet high fidelity wraparound standards.
So Brian, please come on in.
Yeah, hi, Donna. Thank you. Just a clarification about the deadline of the concept paper. I've heard the 21st of August, but on the BH Connect page, where it has the children and youth evidence-based practices at the bottom, there's a link to the concept paper, and it says August 28th.
I will have to do some recon.
Okay.
And find out which one is true and correct. We were provided with the August 21st date. So if they extended it, we'll find out and send it out in an email to our community.
I just put the link in the
Perfect.
chat for you. I'm fine with the 21st, but I just would like to know. Definitely. Thanks.
No, thank you for that. And we'll get some clarification for you, Brian, for sure. And the rest of us. Thank you for pointing that out. Timothy, please come on in.
Yeah, thanks for putting the staffing wraparound toolkit in there. That was very helpful. I think for me, it highlights the fact that we seem to have several different things that are sort of orbiting each other, right? I mean, and so that list, and I haven't looked at it in detail of what you're saying is required, but that list doesn't match the list that's in the concept paper.
Correct.
Right, and so it's this thing, it's like, well, which is it? And so there's a lot that we need to seek clarification on and get alignment on with this, but I am fully on board with the excitement and all of that other stuff. And I'm happy to be a cheerleader with you. I just not as good, but I'll do it. I bump into these little realities of how do we actually do this that make it tougher. So those misalignments are going to be harder, very hard for ultimately, I think for counties to make sense of, to say, okay, this is required of you, right?
Yeah.
And
I agree.
Those are great things for you to submit to comment on the paper. And to be pretty specific, I know I'm like a broken record here, but DHCS is legitimately seeking feedback. They even have embedded questions that they are specifically looking for answers to and want to hear from the community. So this is a very authentic process of genuinely seeking what would be helpful. And again, including guiding questions throughout the document of what they want information on and what they want to hear on. So I mean it.
There are people, you all seem to have an expertise in this and the different sort of areas and elements that are coming into play. I don't know that everyone will. I wouldn't have known that the required thing at the UC Davis site staff list didn't match up, right? Because I haven't looked at that until now. So this is all new. And maybe we'll get an extension. It won't be the 21st, but either way, it'll be hard to match everything up by then.
And the website does say the 28th. So
okay,
I loaded the website and Brian is correct.
Maybe it's a concept paper. They're still developing.
Yes, it is a, and I know that that's hard, and I know that the timing of this was a little difficult, but I also would let you know that we have been working with DHCS for years to get to this point, and we continue to meet with them on a regular basis, including high-level leadership meetings, discussing all of these things. And there is a very genuine effort on both of our parts to work together as much as we can, and to be moving in a direction somewhat together through our different systems. So we are trying our best to all align while everything around us in the world is also changing at the same time. So
absolutely. Thank you, Danny. Any other questions from our community here with us this morning? I know some of you have been side questing and letting me know that you've had difficulty opening some of the documents or getting some of the documents and PowerPoints that have been dropped in today's chat. Don't worry, they will be available online with the recording of our webinar. We will send out a marketing email to our entire community to let you know when that is up and live to have access to the resources. We did send out an email. If you were able to get this email, you received the email around the concept paper. So that you should go back in your drafts or unread messages. It should be in there somewhere from the Resource Center for Family Focused Practice. I mean, that's kind of all we got. Please join us tomorrow. We will have Placer County here with us from 1 to 3 o'clock. Richard's also going to be joining us. Manuel will be back with us as well. We'll be talking about prepping for county approval tomorrow. Also, our second TA, technical assistance drop-in hour, is this Friday from 2 to 3:30. Again, we'll be there for an hour and a half to support you in any questions you may have. Gala had a great idea about bringing in our partners together and being able to team think. That space is open for you and available to however we can support. And we have our regular technical assistance that you can pop into. Hopefully these webinars that we were preparing for you leading up to certification and approval are helpful and beneficial in giving you at least some pre-information going into certification and approval. We've got Simplifying the Standards is our 4th webinar that will be coming in a week and a half. With that, I want to thank both Richard and Manuel for coming in this space and providing us with their expertise today. Thank you so very much. I do want to acknowledge Sarah, Manuel's right-hand woman. Sarah, you are a dream and a joy. Thank you so much for handling Mr. Lua in such great capacity. You are amazing to work with. Again, our partners at the California Department of Social Services, Danny and your team, thank you so very much. And of course, my Resource Center for Family Focused Practice team, thank you.